Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading health experts from your journey to Prime Health in life and business. So today's episode is going to be amazing because we have an awesome doctor that's going to talk about the root cause of health issues and the lifestyle focus on how to improve them, and that's with Dr. Adelola Ashaye. Now, before we dive in, just a quick message from our sponsor, Grow Solutions, where we help transform passionate health care practitioners into profitable practice owners without the overwhelm or guesswork. Grow Solutions helps you eliminate things like how do you generate new leads for your business, patient communication breakdowns. Whether you have operational chaos in your practice, we help you with proven systems and frameworks. And yes, we do help you implement some AI strategies in your business because we want you to enjoy practice as well as life. So we're not an agency or a vendor. We are a partner in the growth of your business. So if you have ever thought or said this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word grow below and feel free to reach out on any of the social platforms. But you're here today for one reason, and that's to meet our guest. And I'm excited to introduce you to Dr. Adelola Ashaye. She's a board-certified family and lifestyle medicine physician and the founder of InTouch Primary Care in Sugar Land, Texas. She provides personalized whole-person care focused on prevention, wellness, and menopause health. Dr. Ashaye practices under a membership model that removes many of the frustrations patients and people feel faced with accessing healthcare, such as long waits, rushed visits, 7 minutes or under, that's no fun, insurance hassles, we all deal with it. Instead, she offers direct access, longer visits, and truly personalized care so patients can enjoy health care tailored to their needs. So Dr. Ashaye, thank you so very much for joining us here on the Prime Health Podcast.
Yes, thank you for having me, Derek. Really appreciate it.
Absolutely. My pleasure. So I like to start out by kind of always asking one of the same types of questions. The question is, was there a moment in your life that you said, you know what, this happened, or something shifted that said, you know what, I want to go into a career in medicine?
Yes, actually. So it happened in high school. I was trying to decide what I was going to do in college, and my parents had made it clear that I wasn't going to go to a four-year college until I knew that answer. They were okay with me going to a community college, less money, but they said, if you're going to go in a four-year college and we're going to pay all that money, you need to know what you want to do. And so I said, okay, fine. I think I might do pre-med. And they were like, okay, well, maybe you should shadow a doctor and find out more. My dad is a doctor too, actually,
Okay.
but he stopped practicing at some point when we moved to the United States. He didn't have the experience of practicing here in the U.S. While we were, I went and shadowed a gynecologist, and it was just a very eye-opening experience. There was a patient he had known for a long time. He was doing a private exam on her, and she was so comfortable. And that encounter really struck me because, they were just like old friends talking. She was really comfortable. It was clear she trusted him. And he was providing a service that was so important for her health, right?
Okay.
And it just was very attractive to me to be in a position to relate with people in that way, where you're connecting with them in a personal way, but you are still helping them, you're impacting them in a very positive way. And that was my first attraction to medicine.
Yeah, love it. Great story. Especially when it's in the family,
Yeah.
sometimes we get pressured a lot to say, hey, I was one, you need to be one too, but it seems like they were open to you making a decision.
Yes, they really were. I have to give them a lot of credit because they were okay with whatever I came up with. I just had to come up with something.
Well, it sounds like you made the right choice. So Dr. Ashaye, it sounds like you were in traditional healthcare for a bit. Tell us about that first experience in being in traditional healthcare.
Yeah, so in the traditional healthcare system, I started to get frustrated at some point because I started to see a pattern. I've been practicing medicine for 18 years now.
Okay.
And the first few years, the first almost 10 years, I was in the traditional care system. And what I noticed was that it just seemed like we're adding more medication. We were managing people's health, but people were not necessarily getting or feeling like they were getting better. Oftentimes, it was either they were like around the same place they were, or they were worse. and and I started to really ask myself some questions, especially when I saw how complicated and how um, confusing and how it can really negatively impact people's lives when their health deteriorates. So I had a patient in residency, had the privilege of seeing her in that program because she had been coming to the clinic for the last 11 years or so. Residency was 3 years. So for the 3 years I was there, I took care of her. But I was able to see her chart from 11 years before. And I noticed that before I started seeing her, 11 years ago, her A1C was 6. By the time I was seeing her, she had very complicated diabetes. She was in and out of the hospital. She was blind in one eye. She had neuropathy. She was in pain all the time. She had really, really bad heart disease. And every single time I saw her, and residency, you see them in the clinic and you see them in the hospital as well. So every time she got admitted, I got to see her in the hospital. Every time she came in the clinic, I got to see her there. And every time she would express such regret for not taking care of her health better early on. And it always struck me how simple it could have been to reverse her prediabetes at the time, 11 years ago, and how difficult it was now to manage this complicated diabetes now. And it didn't just impact her, it impacted her family members, you know, transportation, getting her back and forth, people having to take time off work to be with her in the hospital. It was just a mess. And so that was when I became really passionate about preventative care because I had seen how I was like, this is so easy. We could have fixed this so easily in the beginning. And so that's what I see when I see somebody walk in my office with prediabetes. I'm like, come here, we can do something about it now, please. So I'm very passionate about trying to help people, truly trying to help people prevent complications before they happen.
I love it. It's great to hear that, you're in traditional care. You've had great experiences, I'm sure, all the way through, met wonderful patients, but you realize there was more than what the hospital or the clinic has to offer, because the truth is they want you coming back and they want you to pull out the script pad out of your pocket and write something for them. And that is not the path to healthcare.
Yeah. So in the traditional healthcare, I would say, and I think that is the impression, unfortunately, a lot of people have that doctors just want to prescribe medicine. I think it's actually more that doctors don't have time to process what people truly need in the traditional care model. And so they revert to what what we know best, which is how to very quickly try to quote unquote, fix the situation. But when you're doing a fix without addressing the foundation, it just doesn't work. And that's why people keep adding medications over and over again. Not because, a lot of doctors will love to get people off medication. It's just that they don't have the time. It takes a lot of work and intention to be able to get to do that. And in the traditional care model, there's just not time to do that.
Mm-hmm. So you've shifted yourself into the membership-based direct to primary care model, correct?
Yes,
Yeah.
that's correct.
Yeah. And in that model, prior to doing that, was it just the amount of patients that you could see were being affected that made you make that change? Or was it that there was this one patient that said, I've got to do something different?
Yeah, so it was a patient experience encounter that really birthed that seed for me. I was in a traditional care model and I was seeing a patient with diabetes, and this was another diabetic patient. And he was actually doing really well. Like, he came in, he didn't know he had diabetes. We diagnosed it. But he had frequent follow-ups. He was doing quite well. His A1C was almost normal, maybe normal. I can't remember now. Months passed, and then one day I just realized I hadn't seen him in a while. It's been months now. And I started to, and at that time I had like 2,000 patients in my panel. So it was actually a miracle that I actually remembered that I hadn't seen him. But it was a long time, right? That when I remembered. And so I call him. I was like, "Hey, Mr. Z, what's up?
Mhm.
Where have you been? We haven't seen you in a while." And he's like, "Doc, they won't let me see you." I was like, "What are you talking about?" He's like, "Actually, I came up to your office and the front desk told me you guys no longer take my insurance plan. And so I can no longer see you." So of course I didn't get this message.
Mhm.
But, you know, it was just, I felt very helpless in that moment because I knew it was out of my hands. It was out of his hands. It wasn't his choice not to see me any longer. It was just his job changed his insurance plan. And just based on that, he could no longer have access to this doctor that we've now formed a bond. And then I was like, okay, fine. Have you found another doctor that can help you, through? And he's like, nope.
Yeah.
And I had a flashback to the patient I had in residency. And here
Yeah.
I am here. And I was just like, this is not working.
Yeah.
I think what it did to me was it made me question what I was really doing because I felt like we did all this work to get this patient to this point, right? We are at the point he needs to be. And because of a reason that is out of my hands, out of his hands, we're not able to continue to keep him on this path. So I
Mm.
just felt like it wasn't, because now with the next patient, it was a little harder, honestly, to put in the work
Yeah.
because I don't know if there's going to be another situation where something happens like that and because it does take a lot of like mindset changes in terms of helping people understand what to eat and what not to eat, extra time going through what's causing you stress. And there are a lot of things that go into when you have a diagnosis that is complicated, and to
Mhm.
get somebody to a path where they can feel better, it takes time. And then to do all that and then come to a place where, for a reason that's out of both your control, you're not able to do anything about it. It just made me feel like the work wasn't working. I needed a different way to feel like we were making a difference. So
Yeah.
that's when I started looking at other ways to practice.
Okay.
And yeah, that's how I found the membership model.
Yeah. Well, I'm glad you did. And I'm sure your patients are happy that you've made that change. Unfortunately, there's always a push behind us to make those changes. It happens sometimes. So
Yeah.
if someone's watching or listening to this and we'll just use diabetes. They're a diabetic patient, but they're used to going in and seeing their doctor in the hospital or a clinic in around the hospital. What if they're hesitant to jump away from the traditional model into a clinic like yours or a practice like yours? Can you give us any misconceptions or myths that should say, you shouldn't be concerned about that?
Yeah, I think a misconception is in terms of costs, right? So one of the things that comes up a lot is people say, "Oh, I already have health insurance, and why do I have to pay for a membership?" And I completely understand it shouldn't be like that, really. The problem is the insurance model. The question I ask is, how is that working for you? So if it's working well, then fine. But if it's not working, health insurance is not health care. Health insurance is a promise to
Mhm.
have health care. What we provide is actually health care, right? I ask the person like, what are your health goals? To your health insurance, you're just a number. You're not a human being. You have an ID number, and that's who you are. And do they truly have your best interest at heart? Do they see you as a person? We as people have to take responsibility for our own health,
Mhm.
right? And we have to see what's happening and figure out if the health goals that we have make sense and value our health. So that's when someone asks about, I don't know about this membership thing. I already have insurance. I think it should be paying for all my health care. First of all, it doesn't anymore. Most of us know by now that just because you have health insurance doesn't mean it's going to cover all your health costs. You still pay out of pocket. Second of all, if your health is not getting better and it's getting worse, you're going to pay the price, not just in money in the future, you're going to pay the price in pain and suffering. So you can choose to invest in your health now, which will make you feel better. You get better now and avoid many complications in the future. So if the traditional healthcare model is not working for your health, I strongly encourage you to look somewhere else and take care of your health now and not assume that your health insurance is going to do that for you, because it's not.
Yeah. I really like how you say health insurance is not healthcare. And that's a great way to think of it, that we oftentimes, myself included, sometimes think that, okay, if my health card doesn't cover it, then
Right.
maybe I shouldn't get it done. And that's just that's not the case at all, at
Not
all. On so many levels, especially for diabetics or any,
right.
congenital heart, anything like that. Yeah. It's very
Yeah.
unfortunate.
And we see the denials. A lot of the denials don't even make any sense. Need I've seen denials of people that that A1C was very high, like 13, and the health insurance company wants us to show A1C of 13 for 3 months before they will approve a needed medication. I mean, that is obviously not a
That's just
plan that works for the human being, right?
one more step closer.
There are all kinds of, so it's clear that you can't depend on that to take care of your health. You have to take ownership.
Yeah, good. So at your practice, InTouch Primary Care, how does your model work if somebody still does have, Blue Cross Blue Shield, for instance?
Yeah, so for the things outside of the practice, if they need to see a specialist, for instance, certain testing, especially more expensive testing, if they need to go to the hospital, their health insurance will cover that. But then for primary care, which is 80 to 90% of what many people need to take care of their health, we cover that. And their membership covers that. And the advantage of a practice like ours is we don't do unnecessary referrals. We really would work with people because we have the time to figure out what's truly going on and to really get to the root cause. And with my lifestyle medicine background, we help build a healthy foundation first. And so it really minimizes how much we're sending people out. When we do send them out, it's for a good cause. And then we also help them find savings. So a lot of people by now know that just because you have health insurance doesn't mean that when you go for that MRI, you don't end up with a really high bill. When you go for, even a diagnostic mammogram, for instance, can be much more expensive. So they're all people know that they end up paying out of pocket. Oftentimes they get a surprise bill. Um,
Mhm.
with our practice, we tell you upfront what your costs are going to be. The membership is flat, and then if we're doing things outside of the practice, we've made connections with a lot of the health services in the area, and we're able to help people save a lot of money with going to places that will, give them a good deal in terms of testing.
Yeah, love that. What outcomes have you seen of people switching and understanding that model? Like, is it fewer medications, better improved lifestyle? What do you attribute that to with the membership model? How that helps your patients even more?
Yeah, the fewer medications is huge, right?
Okay.
Because once you fix the foundation, I think we underestimate how just healthy nutrition and healthy nutrition, there's so much misconception about what is healthy. Like that, people have so many different ideas. Social media now, everybody's a health guru. And so there are all kinds of advice in terms of nutrition, but evidence-based healthy nutrition, can make a big difference. Some people, that's just changing a few things in their diet makes all the difference. I had a patient recently who had hemoglobin of 6 when she came.
Hmm.
And I was like, how are you even, and she didn't want to have a transfusion. She didn't want to have an iron infusion. And I said, okay, we can work with you. However, you're going to have to do the lifestyle changes that we talk about. And we put her on a nutrition on a plan, and she followed it. It was plant-based. We stopped anything that had saturated fat to reduce her inflammation. We started her on high-quality supplements, and her hemoglobin is now normal. So there are ways so people, there is a lot of misconception about what is evidence-based. And so when you try different things without tracking it, without going to someone who understands the science, you often don't get the results. But when you do, we get great results with that. We get weight management. We've had a number of people lower their weight with lifestyle changes alone, by focusing on lifestyle habits to help them do that. Even with menopause care, we've helped people with and without hormone replacement therapy to, thrive during that transition, to feel more comfortable, to avoid urinary tract infections, and to enjoy their relationships again, because now they can actually have intimacy. So we've we've been able to really help people. And what I like the best about it is I can see that there has been a change, because they're not switched, they're not going to a different doctor. We're following up a year later, 2 years later, 5 years later. I can see their health improving. I can show them your blood pressure was this, 3 years ago. Look at what your blood pressure is now. It's so fulfilling to be able to show people that their health is actually getting better.
Yeah. Yeah, you're absolutely making lifestyle changes for them, not just medicine changes, but lifestyle changes for them, which is fantastic. I want to ask about some other things about the practice in a second, but what are you focusing on in your business right now?
So we've been focusing on the Healthy Weight program more recently, and that ties a lot into menopause care too, because that's one of the most common visible complaints when people are going through the transition, is the stubborn weight that seems to just appear, especially around the stomach. So, helping people understand the hormonal changes that can during that period, and also, how weight management can truly help them feel better in terms of, joint pains, in terms of just mental health even, and so many other things that come with metabolic health, of course, preventing chronic conditions and all of that. So we've been focusing a lot on helping people achieve a healthier weight. Really, truth be told, it's more about helping people be healthy. But if
Yeah.
I don't say healthy weight, people are not, they don't connect as much. So I use the weight to draw people's attention to their health, because
Yeah.
that's what a lot of people care about that.
Yeah. They want the pounds off, but you improve the health after you do that as well, which is fantastic.
Yes.
What's the biggest challenge that you're experiencing right now in your business?
Well, I think, let's see, challenges. Sometimes I think it can be hard to help people see the value of health.
Hmm.
Um, uh, Many people show up after the fact, right? So something
Yeah.
happened, yeah, that brought their attention to their health. And I understand it's easier for me because I see it all the time. So it's easier for me to pay attention to it, right? But for someone
Mhm.
who's busy and has life to life, they may not be as focused on their health. And so just being loud enough is can be challenging to say, we've talked about this. We
Yeah.
need, so I think that's the greatest challenge, helping people see the value of healthcare, like proper healthcare.
Okay. From a technology standpoint, have you seen AI making a change in how you care for patients?
Absolutely, yes. And it's like with anything, you either embrace it or,
Don't
you're
get
scared of it,
online.
right?
Yeah.
Fortunately, I've embraced it, and I think it has helped people. There are many platforms that, even their HIPAA protected platforms, where AI is used, that doctors can use to help with diagnosis and treatment plans. So I use those. There are AI, even with ChatGPT, in terms of like, helping people come up with plans faster. I use that, like, based on, all the things, different things you can help people. You can come up with even AI chats that will make things faster for people in terms of, hey, use this to figure out how many calories you should be eating, and put all the things you like to eat in chat, and help it tell it to come up with a practical meal plan that
Yeah.
you can use. So I try to use AI to make things more efficient and effective. And try to show, patients that might need it, that they can use it as a tool to help things go faster and make it easier for them to follow.
Good. Yeah, you hit it on the head, Doc, in the fact that if you're not adapting to it at somewhat, it doesn't mean you have to be using it in every aspect, but it's coming whether we want it to, and it's coming even harder, and quicker. It's amazing how it changes on a daily basis. I wish it
Yes,
was on a yearly basis, but it's
daily.
daily. Yeah, it's very, very difficult. So from a differentiator standpoint, what do you feel you do, Dr. Ashaye, different than anyone else out there in primary care from a direct primary care standpoint?
Yeah, I think what is different is what I've heard anyway from when patients talk about our practice is that we listen.
Mm,
And I think that really makes an impression on them, because for me, listening is not just for them, it's also for me to understand what might be happening, because the more I know, the more I'm able to help. And I think we underestimate how much time it takes to really understand the situation. I've had patients who have been with me for a year, and it's in the second year that I found out something that was vital.
mm,
Um, because they just didn't think it was important, right? I'm like, oh, you had a family history of that? I thought we asked about your family history. It's like, oh yeah, it's just, I forgot, or, or even there was one time I asked people to bring their medications with them, especially on the first visit, so I can see them. And we've been doing this with this patient for a while because they had a lot of medications. They bring it in, let's go through all of it and everything. And then it was like the fourth or fifth time they showed up with insulin because it had been in the fridge
yeah,
and never mentioned. And you would know we had talked about this
yeah,
over and over and over.
yeah,
So it's amazing, right? Like, and I was like, I mean, it was a small dose they were taking, but still, that
right,
it was controlled. So we didn't have a need to change anything, but I just didn't even know. So
right,
it's pretty interesting. So I think the time that one takes to listen makes a difference, because um, it helps us understand better. It takes time. Health is not something that can be done just zip through and rushed.
right,
You have to take the time to understand, and especially as people get older, it gets more and more important. Or when people have chronic conditions that they're dealing with, it's so important that we understand what's happening fully. And that's when we can truly help people make change faster and help them feel better faster, when we have that understanding.
yeah. It's so critical. It is unfortunate because there's still great physicians in the clinical setting that want to do what you do, but they have the constraints of the hospital. They have the constraints of the board of the hospital. And it's
Yes.
hard, and they're just not willing to take that leap of faith just yet. But, the more they hear people with success like you've had, the better they're going to be in that position. So I will definitely share all of your contact information, whatever you like to share, we'll put it in the links below. But if there's a listener or a viewer that's, paying attention to what's happening, they feel rushed at their doctor, they don't feel as though they have enough time, where would you like them to learn more about you or options that you offer where they can explore joining your practice?
Yeah. So I think the best thing would be schedule a 15-minute, a complimentary 15-minute consults with me. It's complimentary through our website, intouchprimarycare.com, and we can share the link as well for the direct link to the 15-minute consult, because that would be the best way to connect with us and learn, and we can hear what your needs are and make sure that we're a great fit.
Yeah. Fantastic. It's short, sweet, but important, impactful. That's important 15 minutes versus sitting at your doctor's office for 7 minutes. So
Right.
that's great. All right. Two last questions here, Doc, for you. From an overall health perspective, if there's one piece of advice you could give everyone that's listening to this that could affect their health in a positive way, what would that piece of advice be?
I'll say have a goal and
Hmm.
try to do it get 1% better every day, right?
Every-
So it's when you have people don't think about health goals, but that's one of the things I challenge my patients. So one of the first questions I ask when I meet with people what is your health goal?
Mm,
What do you really want for your health? And it helps them think about what they're trying to achieve. And then we're like, okay, don't think about all the barriers yet. If you truly want, okay, what are you willing to do? What's the price you're willing to pay to get here? Because you can't walk into Walmart and say want an iPhone 10 and say, oh, I only want to pay $20 for it.
mm.
Like, you're not coming out with that phone,
Yeah.
right? So you could get maybe a refurbished what an iPhone 6 but like $200 whatever, but you need to be willing to pay the price, right? So what are
Mm,
you willing to do to get to this goal? And if you're not willing, maybe we can make the goal a little smaller for now, you know, and pay that price and then inch towards your overall big goal. But having a health goal, working towards it intentionally makes a
mm,
difference. For instance, for me, I'm on the treadmill most mornings and I challenge myself. I just go up just one mile whatever, 1 point faster. I don't know how it's measured, but every
yeah.
so often, like if it's been, a couple of weeks I've been on the same speed, I'm like, let me just go a little faster. And, for the first 2 minutes, I'm like, oh my God, this is so hard. But then after a while, it's easier and easier. So challenging yourself to do a little bit more, and then you'll find yourself there.
Yeah. In life, we have two choices. It's to give something up to gain something. And most people aren't willing to give that up to get the gain. But setting small baby step health goals, I think, is a great way to go through that. So, Dr. Shaya, a question. You are on the Prime Health podcast. Would you mind explaining your definition of what Prime Health is to you?
Yes, so I think prime health is when your body, your mind, and your spirit is working at their best.
Hmm.
So it's not just being free from illness, but it's also being full of energy, full of life, where you're thriving.
Hmm.
So that's my definition.
Yeah, I love it. Thank you very much for sharing that. I love asking those last two questions because I get different answers every single time. It puts it back in my little memory back there to try and help myself improve. So it's good, and for viewers and listeners. So, Dr. Shai, thank you so very much for being a guest today. I really appreciate you sharing your unique perspective from childhood, deciding what you want to do. And having very open parents to not forcing you into that situation, and realizing that you're giving as a physician, and it's important that you did that, but realize that there's more I can do. And your patients have benefited from that. And I'm sure you have too, of making that change in it. And I always say at this point for people that are watching or listening, if there's something that Dr. Shaye said, whether it's for your business or for your personal health or somebody that you know that could take this information and learn from it and grow from it, please share it to just that one person. If we can help affect just one person at a time, that's all we need to do. If there's 7 people you know that would benefit from Dr. Shaye, I'm sure she wouldn't turn them away. But if you could share that with us. Selfishly, I always say, please share the Prime Health podcast and subscribe to it because we always like to see what we can do to grow. But until next time, remember that true wellness is a journey we are all on together. Now, whether you are taking charge of your own health or guiding others in theirs, every step forward matters. So I always say, please stay committed to your Prime Health journey. And Dr. Shai, thank you very much for being a guest on the Prime Health podcast.
Thank you, Derek, and thank you for having me.